Today, we're going to be talking about prenatal diagnostics in both Australia and Kenya. First of all, prenatal diagnostics are the tests that are done on pregnant women to ensure that they have a healthy pregnancy. Here, there are two pictures of Anna and Afia. Anna from Australia, Afia from Kenya. Both of them were pregnant during the same period and undergone pregnancy tests. So, in the first testing that was done for Anna, she undergone a combination of blood, urine, and a pap smear test, in which blood and urine tests were done to legitimize her pregnancy, to make sure that she might not have a future risk of having cervical cancer. And I was wondering about Kenya. How was Afia received there?
Yeah, so Afia was one of the 45% of pregnant women in Kenya who attended all 4 of the recommended antenatal care visits. As you'd expect, the pregnancy tests would come first. However, in Kenya, they're not widely available, so healthcare workers use her symptoms and palpation to diagnose her pregnancy. They also do routine blood and urine tests to test for HIV and AIDS, malaria, bacterial infections, sexually transmitted diseases, and anemia. Ultrasounds aren't routinely given in antenatal care visits in Kenya. However, you can get them in if you have private healthcare or if you live in one of the big cities.
Fortunately for Anna, ultrasounds are routinely given to pregnant women in Australia, both in private and, most importantly, public hospitals. And after the ultrasounds were done for Anna, she actually wanted to know more on further testing, so she underwent screening and diagnostic tests because she had some fear that her baby might have genetic diseases that were linked to her family. So first of all, she underwent further ultrasound to check on the shape and positioning of her baby, and then after that she went through and took a newly found disease called the NIPT, the non-invasive prenatal test, in which this test was done, taking a blood sample from the mom, and then the DNA of the baby was extracted from that, in which further analysis was done. Anna wanted to do more tests, which were more related to diagnostic tests, which were CVS, chronic villus sampling, and amniocentesis. Both tests use a technique by which a needle is inserted through the abdomen and a sample is taken. Amniocentesis takes a sample from the amniotic fluid, while chronic villus sampling takes a sample from the placenta. Both tests, again, check for diseases that are found or abnormalities that are found in the genetic DNA of the baby. Fortunately for Anna, the baby had no problems. But I was wondering about the opportunities like that were offered in Kenya for Afia.
Okay, so Afia wouldn't get the option of these invasive diagnostic tests. These reasons may be because Kenya is in a low economic region, so therefore there's a lack of facilities, equipment, and labs for testing. Also, as I said before, Afia is one of the 45% of women who attended all 4 antenatal care visits. However, overall, 91% of women attend 1 antenatal care visit, and this very often, as widely reported, happens very late in their pregnancy when they first attend, up until the 6th or the 7th month. By this time, the focus of the healthcare workers is to put in place a good birth plan and also do the routine blood and urine tests. Another reason why CVS and amniocentesis isn't routinely offered is, in fact, that Kenya has abortion is illegal, and therefore if a woman had a positive test, then her options afterwards may be limited. Another reason as well why they might not be offered is linked to economic reasons as well, is there's a lack of workforce in Kenya, and therefore there aren't enough healthcare workers to provide the test for the pregnant ladies.
Right on. However, in Australia, it is known to be a high economic region in which people can afford to undergo the tests, and the medical facilities are well equipped for that. Therefore, high medical standards are also offered. And moreover, 90% of pregnant women in Australia do attend the majority of their healthcare visits, which are 4, which is more than sufficient, and that could be linked to having high standards of education, high educational standards in the region. And that was a summary of the differences that can be seen. Thank you all for listening.
Thank you.